Macrovascular diabetes complications refers to damage done to the large blood vessels caused by diabetes. These complications can occur in blood vessels or veins in any part of the body and include heart disease, stroke, and peripheral artery disease. I'm going to go into a little bit of detail on each one, and hopefully by the end of this video you will have a better understanding of the macrovascular complications of diabetes and what you can do to prevent them from developing. People who have diabetes can develop diabetic heart disease and often have a higher risk for heart disease than other people without diabetes. People who have type 2 diabetes have the same risk of heart attack and dying from heart disease as people who have already had heart attacks, showing that diabetes alone is a serious risk factor for heart disease. We will talk about the risk factors for heart disease and the other macrovascular complications later, but very often people with diabetes tend to have a variety of other risk factors for heart disease, such as overweight and obesity, and the combination of diabetes and additional risk factors causes harmful physical changes to the heart. This whole process increases the risk for heart disease. Diabetes raises the risk of earlier and more severe heart problems. Patients with diabetes tend to develop heart problems at a younger age than people without diabetes. The most common form of heart disease in diabetes is coronary artery disease and congestive heart failure. In coronary artery disease, a waxy substance called plaque builds up inside the coronary arteries. These arteries supply your heart muscle with oxygen-rich blood. Plaque is made up of fat, cholesterol, calcium, and other substances found in the blood. When plaque builds up in the arteries, the condition is called atherosclerosis. Plaque narrows the arteries, and this reduces the blood flow to your heart muscle. The buildup of plaque also makes it more likely that blood clots will form in your arteries. If a blood clot gets stuck in one of the narrowed arteries, it can partially or completely block the flow of blood. When this happens, it means that the heart is not getting all that it needs, and this can cause chest pain or discomfort called angina, irregular heartbeats called arrhythmias, a heart attack, or even death. Congestive heart failure is a condition in which your heart loses the ability to pump blood effectively, and so can't pump enough blood to meet your body's needs. The term heart failure doesn't mean that your heart has stopped or is about to stop working. It just means it isn't as effective as it should be. Shortness of breath with exertion and leg swelling are the main symptoms of heart failure. Coronary artery disease is a major cause of congestive heart failure as it weakens the heart muscle over time. Symptoms of heart disease include chest pain or a feeling of squeezing or pressure, decreased tolerance for physical activity, chronic fatigue, shortness of breath, swelling of the legs and ankles, and palpitations. A stroke occurs when the blood supply to a part of the brain is suddenly cut off, resulting in a decrease of oxygen and blood to the brain cells. Without oxygen and blood, the cells in the affected area of the brain become damaged or die. The most common type of stroke is called an ischemic stroke. Ischemic means a reduced blood and oxygen supply, and this is often caused by a blood clot that has blocked the flow of blood in an artery. The blood clot often forms within the artery itself, and this commonly occurs over a patch of plaque in the veins or arteries. If the plaque becomes thick, it can trigger the blood to clot. If these arteries become narrow as a result of atherosclerosis, plaque or cholesterol, debris can break off and float downstream, clogging the blood supply to that part of the brain. A hemorrhagic stroke is caused by bleeding in the brain. A damaged or weakened artery may burst and bleed, and the blood will then spread through the other tissues in the brain. This can cause the affected brain cells to lose their oxygen supply, and they then become damaged or die. This happens in about 1 in 10 strokes. The most common reason to have bleeding within the brain is uncontrolled high blood pressure. There are 4 different arteries that branch into many smaller arteries in order to supply blood to all the areas of the brain. The area of the brain affected and the extent of the damage depends on which blood vessel is affected. For example, if you lose the blood supply from a main artery, then a large area of your brain is affected, which can cause severe symptoms or death. In contrast, if a small branch artery is affected, then only a small area of the brain is damaged, which may cause relatively minor symptoms. Whether or not the damage done by the stroke causes a disability depends on the part of the brain affected, how quickly treatment was given, and the extent of the damage to the brain. Rehabilitation is a big part of the treatment of a stroke and usually helps to reduce the chance of permanent disability. Symptoms of a stroke include impaired speech, inability to see in one eye or double vision, inability to walk, paralysis on one side of the body, and numbness or tingling. In peripheral artery disease, the blood vessels in the legs and feet are narrowed and blocked. As with the two previous macrovascular complications, the resulting decreased blood flow is what causes the problems. Poor circulation of blood results in poor wound healing, and this means that even a minor injury or infection could develop into a serious problem. This increases the risk for amputation, as well as the chances of heart attack or stroke. Symptoms of peripheral artery disease include pain in the calves when walking, coolness of the lower extremities, loss of hair in the legs, ulcers or wounds in the legs that don't heal properly, and pain in the feet when resting. So, as someone with diabetes, you have quite a high risk for all these complications we just discussed. However, diabetes is just one of many risk factors for heart disease, strokes, and peripheral artery disease. Age, gender, family history, and ethnicity are all non-modifiable risk factors for macrovascular complications, meaning we can't do anything about these risk factors. There are some ways that you can decrease your risk though. There are some risk factors that you do have control over, and these are known as modifiable risk factors. Eliminating them can decrease your risk. These are things like unhealthy blood cholesterol levels, high blood pressure, smoking, overweight or obesity, an unhealthy diet and physical inactivity, and stress. Unhealthy blood cholesterol levels includes high LDL cholesterol and low HDL cholesterol. Changing your lifestyle can play a role in correcting your blood cholesterol levels, and where this isn't effective as needed, statins are often used to treat the cholesterol levels. There are other types of medication that can be used if, for some reason, the statins don't work, but their effectiveness is not as properly established. Blood pressure is considered high if it stays at or above 140/90. In people with diabetes, though, we try to keep blood pressure below 130/80. High blood pressure remains the most important, well-documented, modifiable risk factor for stroke, and treatment of high blood pressure is among the most effective strategies for prevention of both ischemic and hemorrhagic stroke. The third risk factor is smoking. I'm sure that you've heard endless lectures about how bad smoking is for a person, but if you have diabetes, it's even worse. Smoking can damage and tighten your veins, lead to unhealthy cholesterol levels, and raise blood pressure. Smoking can also limit how much oxygen reaches the body's tissues and increases the risk of an ischemic stroke. Being overweight or obese raises your risk of heart disease and heart attack. Overweight and obesity are linked to other heart disease risk factors such as high blood cholesterol, high blood pressure, and diabetes. Other lifestyle habits can also play a role, such as a lack of physical activity and eating an unhealthy diet. Both can increase some of the other risk factors like blood pressure and cholesterol levels and can also cause overweight or obesity. Stress and anxiety can trigger your arteries to tighten. This can raise your blood pressure and your risk of having a heart attack. Stress also may indirectly raise your risk of heart disease if it makes you more likely to smoke or overeat foods that are high in fat and sugar. So we have now spoken about which conditions make up the macrovascular complications, what they are, and what the risk factors for these conditions are. The last thing, but possibly the most important, that we need to talk about is how to stop all of this from happening. Prevention is, after all, a lot better than cure. Quite obviously, most of what I have to say addresses the modifiable risk factors I've just mentioned. Quitting smoking would have quite a few health benefits, a lot more than just in terms of diabetes and your risk for complications, but it would definitely reduce the damage done to your veins and arteries and decrease your risk of having a stroke. It is important to check your blood pressure on regular occasions and make sure that you treat it if it is high. High blood pressure usually has no symptoms but can also damage arteries. If you have high blood pressure, treatment of blood pressure is likely to have the greatest effect in reducing your risk of having a stroke. Losing weight is an important part of improving your health status, as well as reducing your risk for complications. Losing weight, even just 5 to 10% of your current weight, will improve your blood sugar, blood pressure, and blood cholesterol control. You can work out how much you should lose by calculating your BMI or make an appointment with a dietitian. Together, you can set goals and begin the journey to achieving a healthy body weight. Increasing the amount of exercise you do will help you to achieve and maintain your goal weight. Current guidelines for exercise encourage you to aim to do some moderate physical activity on most days of the week for at least 30 minutes at a time. This doesn't need to be anything extremely difficult. You can start wherever you feel comfortable, as long as you are slightly raising your heart rate. Brisk walking, swimming, cycling, dancing, gardening, and running are all things that you could do, and you can set the pace yourself. Try to make exercising regularly a habit. Use the stairs instead of the lift or escalator, and walk briskly wherever you go, so that exercise becomes a part of your daily life as far as possible. Along with exercise, your diet plays an important role in losing weight. In diabetes, diet is also crucial to your blood sugar control, and unhealthy eating habits can increase your cholesterol and blood pressure. People with diabetes should limit or avoid the intake of sugar, sweets, and sugar-sweetened beverages to reduce the risk for weight gain, decrease your risk for heart disease, and improve your blood sugar control. You should try to eat at least 5 portions of a variety of fruit and vegetables per day. Try as far as possible to eat the fruit and not drink it. In other words, try to keep fruit juices to a minimum. Remember that fruit also contains sugar, so try to eat more vegetables than fruit, and don't eat more than 1 fruit at a time. Evidence suggests that there is not an ideal percentage of calories from carbohydrates, protein, and fat for people with diabetes. This is where diets like the low-carb, paleo, Banting, and Atkins diets come in, and perhaps a few others that I haven't mentioned. Even though there is quite a bit of hype about the type of diet that is best for people with diabetes, or people who are just trying to lose weight, there is no conclusive science to suggest that one is superior to the other. Each diet does perhaps have studies proving its effectiveness in weight loss, but eating less calories than usual will also have that effect. Though the different diets may induce weight loss, some may have negative components to them, like increasing your cholesterol levels and the workload on your kidneys. You need to keep this in mind when choosing an eating pattern, and it might be a good idea to chat to a dietitian before making drastic changes to your diet. You do need to remember that carbohydrates do affect your blood sugar, so though there is not an official recommendation, you should try to limit your intake. A good guideline to use is to make sure that you eat the same portion size of carbs at each meal throughout the day. 1 cup of starch per meal should be enough, and this is roughly the same amount as your closed fist. Fat should be kept to a minimum and should not contribute more than 30% to the total daily intake of energy. It is recommended that you use low-fat, mono, or polyunsaturated spreads. In terms of protein, you should eat a variety of protein sources on a regular occasion. Eat about 2 to 3 portions of fish per week. At least one of these should be oily. If you eat red meat, it is best to eat lean red meat or poultry such as chicken. If you do fry, choose a vegetable oil such as sunflower, rapeseed, or olive oil. Try not to add salt to food and limit salty foods. Start reading the labels on the back of the food and ingredients that you buy, and be aware of the amount of salt that it contains. You will be surprised at the amount of salt that the food and ingredients you buy contain. When it comes to alcohol, try not to drink more than the recommended limits. That is, men should drink no more than 21 units of alcohol per week, no more than 4 units in any one day, and have at least 2 alcohol-free days in a week. Women should drink no more than 14 units of alcohol per week and no more than 3 units in any one day, and they should have at least 2 alcohol-free days in a week. Remember that alcohol can affect your blood sugar, so avoid drinking alcohol on an empty stomach and keep testing your sugar on a regular basis, especially before going to bed. I hope that you have a bit of a better idea as to what you need to do to decrease your risk for macrovascular complications of diabetes. Before we finish up, I want to encourage you to set some goals for increasing your physical activity and losing weight, but make sure that they are realistic. A realistic goal or lifestyle change is something that is sustainable. In other words, it needs to be something that you could do for the rest of your life. What I mean is, Don't choose a diet that will result in the quickest or the biggest weight loss, but that you can only stick to for a week or two. Don't start an exercise program that requires you to do intense exercise every day when you currently don't do any exercise at all. Making sure that the goals and changes are realistic will help you to stick to them and keep off the weight that you've lost, keep up with the exercise, and keep your risk for macrovascular complications low.